So very good evening to all of you. Are you people there? Am I visible, audible to you people? Someone confirm visibility, audibility is great, so we can start ahead. Someone from the audience in the chat box, please confirm fast. Okay, thanks. Okay, thank you. Thanks for confirmation. So I welcome you all for today's session. A very good evening to all of you. I am Dr. Priyanka Sachdev, and today I am here to continue my series Oncology by Dr. Priyanka. We have started neoplasia from general pathology. Already 2 days have occurred since this series has started. So we have started only one topic yet now. General neoplasia from general pathology. So in neoplasia, before starting the topic, let me do an announcement about the Bucks Bounty. So all the audience who are listening this lecture, they have an opportunity. This is an opportunity for all learners. If in any video on Unacademy platform, or not only of me, of any educator of Unacademy platform, if you find any inappropriate content, by inappropriate content I mean if some information is wrongly delivered to you, some MCQ, you think there is some discrepancy in the answer should be something else, and educator is giving explanation for some other answer. So if you find any inappropriate content or any which is the content which is not up to date, then you can report this issue to the team. And if you are first to report about that issue, you have opportunity to win the prize. So be attentive during the lecture. And so this is an announcement. So in neoplasia, in oncology series by Dr. Priyanka, in neoplasia, we have started. We have already covered genetic regulators, that is molecular mechanism of cancer is over. We have covered the 4 types of genes: proto-oncogene, tumor suppressor gene, apoptosis regulating gene, DNA repair gene. Those who have missed it, you can't afford to miss it. Whatever prof student you are, whether you are a first prof, second prof, pre-final, final, or an intern, whatever, or a dropper, whatever student you are, you can't afford to miss this topic. You can't. So please, I request you all, those who have missed it, to watch the recordings. Some recordings are available on YouTube. Some of them are available on the special classes. So check for the links and watch all the recordings. Number one thing, this we have already finished. Second topic which we have finished there is carcinogenesis today in the morning. Today I have taken 2 classes on YouTube. On both of them I have finished carcinogenesis cover to cover. So carcinogenesis, the 3 type of carcinogenesis: chemical carcinogenesis, all steps; physical carcinogenesis, both radiations, UV as well as IR; and biological carcinogenesis, all viruses, all bacteria, all parasites are completed by me in the morning. So please see the recordings if you have missed it. There is one more announcement for you, that Unacademy app is launching a new feature for the students, that is Ask a Doubt. If you have any doubt related to the subject in any of your subject, there are 19 subjects. So if any of your subject, if you have any doubt in your MCQ or whatever doubt you are having, so what to do? You go on the app, you will find Learner's app, you will find an option there, Ask a Doubt. Click that option. After clicking that option, take the snapshot of the doubt you are having. Crop your snapshot so that the doubt should be specific. Don't take the snapshot of the whole page. So take a snapshot of the and crop it to specify your doubt, and then post your doubt under the specific subject. There are 19 subjects given there. So whoever educator is available in that subject, if you ask a doubt in pathology, I will be there. Some other educators are also there. So whosoever will be available, they will answer your doubt instantaneously. So your doubt will be addressed. So whatever doubt you are having, please come on the app. And please share this information with your colleagues also. Done. So these were the announcements for you. So let me start a new topic now. So the new topic I'm going to start now are clinical features of what? Of course, of neoplasia or tumor. So neoplasia or tumor. What are the clinical features? One of the main clinical feature in neoplasia is paraneoplastic syndrome. So I will discuss paraneoplastic syndrome in detail. Let me enumerate all clinical features. So I will give a brief introduction about the rest of the features, clinical features, but I will discuss paraneoplastic syndrome in detail. Done. So let me start the clinical features of neoplasia. So clinical features of neoplasia can be divided. Any tumor I'm talking about, not any particular tumor. So the tumor can be any. It can be brain tumor, eye tumor, nose tumor, stomach tumor, ovary tumor, testes tumor, genital tumor, urogenital tumor. So any tumor. So in general, we are talking the clinical features. So any tumor have 2 types of clinical features: local and systemic. So let's talk about local first, then we will talk about systemic. Paraneoplastic syndrome will come in systemic. So let's see first local effects. There are 4 local effects. So wherever that tumor is present, particular tumor is present, it will compress the adjacent tissue. If it is a benign tumor, it will compress. If it is malignant tissue, it will invade. It will infiltrate inside the surrounding tissue. So this is a tumor. This is a tumor, you see, and this is the surrounding tissue. This is the surrounding tissue in which tumor is present. And these are the tumor cells. The red colored are the tumor cells. So if it is a benign tumor, it will enlarge in size, and push the adjacent tissue, but it will not invade the adjacent tissue. So because of compression, patient may get some symptoms, number one. And if it is a malignant tumor, the tumor cells will invade. They will come out and invade the adjacent tissue. So because of this invasion, patient may have symptoms. So tissue destruction is there. So these are the two symptoms due to benign and malignant. And if the organ is luminated, like it is gut, it is intestine, it is stomach, then there can be mechanical obstruction. There can be, you can see. So can you see the best example of compression? If there is a tumor in the bone, in the vertebral bone, can you see here? And it is compressing the spinal cord. See the shape of the spinal cord here at the place of the tumor. Can you see the spinal cord is compressed here? So that is the best example of compression. Patient will have severe back pain and other symptoms. Paralysis can also occur. So that is compression. Obstruction, you can see the intestine here. In the intestine, this is the tumor. Tumor is obstructing, so patient is presenting with severe abdominal pain and constipation. So obstruction can be there. And you can see that is compression and that is invasion, that I have already explained you. In the surrounding tissue, benign tumors only compress and malignant tumors invade inside. So they are causing tissue destruction. So these are the local effects. Coming on the systemic effects, which are more, more useful to understand. So more difficult to understand. So coming on the systemic symptoms of the tumor, local symptoms, you already got it. Compression, obstruction, destruction, hemorrhage, you got it. So whatever side the tumor is present, it is presenting symptoms there. Coming on systemic manifestations of the tumor. What are the systemic manifestations of the tumor? There are 4 systemic manifestations of tumor. Cancer cachexia. Yes, Rocket, you are right. Cancer cachexia, number 1. Fever, number 2. Tumor Lysis syndrome, TLS. Tumor Lysis syndrome, number 3. And Paraneoplastic syndrome, PNS, number 4. So I will discuss TLS and PNS in much detail. So let me start with cachexia. A few lines about cachexia, a few lines about fever. So how cachexia occurs in cancer, what is cachexia and how it is occurring. Fever, how fever is occurring in cancer, in generalized in any cancer. Then we will come on tumor lysis syndrome, and in the end we will discuss paraneoplastic syndrome in much detail. Should I start? So let me start with cancer cachexia. So does anyone know what is cachexia? What is cancer cachexia? Cancer cachexia means, this is cancer cachexia. Typically you can say a cancer patient who is having cancer, primary or metastatic cancer, lose weight tremendously. He will become lean, thin and lose weight. Muscle wasting is there. Typical muscle wasting is seen and adipose fat liposis is seen. So जो muscle है उसमें muscle wasting हो गया और जो adipose tissue है, जो fat है, उसमें lipolysis हो गया. So muscle is lost and fat is lost. So muscle and fat से तो body बनी होती है. So patient will become lean and thin. So this is known as cancer cachexia. That is the definition of cachexia. So patient presents with anorexia and increased nutritional demand due to, why it is happening? Why? What is the reason? Number 1, if the patient is having tumor now due to the psychological impact, and if the tumor is in GIT, stomach, esophagus or intestine, patient will have loss of appetite. Patient is not eating anything. That is anorexia. Anorexia means loss of appetite. So patient is eating less. So if it is in GIT, of course, he will eat less. And if it is not in GIT, some other part also, breast is there, some other tumor is there. But due to the psychological impact, patient is depressed that I am having tumor. So he will eat less. So anorexia is there. Number 1 reason. Number 2, increased nutritional demand of the tumor. Whatever patient is eating, although he is eating less, वो जितना भी खा रहा है, so it is utilized for proliferation in the tumor cells. So it is utilized by tumor cells only, बाकी के body को कुछ मिल ही नहीं रहा है. So that is why these are the 2 reasons of weight loss, main 2 reasons. Now what is the mechanism? There are 3 cytokines which are responsible for cachexia: TNF alpha, interleukin 1 and interferon gamma. Interleukin 1, interferon gamma or tumor necrotic factor TNF alpha. These 3 cytokines, what they are doing, listen. See, this is a tumor. Can you see? This is a tumor. Any tumor. These are secreting these cytokines. What I have enumerated: TNF alpha, IL-1 and interferon gamma. These 3 are the main. So these are secreted by the tumor cells. So these cytokines are doing 2 things. Number one, in the muscle, in the skeletal muscle, they are causing muscle wasting in the skeletal muscle. And in the adipose tissue, they are causing browning or lipolysis. You know what is browning? So it is lipolysis of the fat. So muscle become thin, compare it. It become thin, it is wasted, it is thinned, and adipose tissue, browning is there, lipolysis is there, so it is also decreasing. So ultimately muscle भी गई, ultimately fat भी गया, तो पूरी body तो muscle और fat की बनी है ना, muscle भी गई, fat भी गया, तो बचा क्या? So only carbohydrate is there. So patient is presenting with severe weight loss. That is cachexia. Done. So browning is lipolysis only, necro. So muscle browning is there. That is muscle lipolysis is there in the fat cells. That is acetyl-CoA. It is undergoing lipolysis. So that is the thing. So cachexia is there. Done. So the same flowchart in a different format. So cancer, tumor cells secrete pro-inflammatory cytokines and anabolic hormones. Let's talk about pro-inflammatory cytokines. Which are the important ones? TNF alpha, IL-1 and interferon gamma. These three are the important ones. What they are doing? They are doing lipolysis. They are doing muscle loss. Where it is written? Okay. Myogenesis, muscle wasting. So weight loss is there. Muscle atrophy is there. Anemia is there. Decreased chemotherapy tolerance is there, and ultimately it is leading to cachexia. Anorexia to hota hi hai. Anorexia or loss of appetite to hai hi na. Patient is depressed also, and due to these also anabolic hormones are secreted na, like insulin. So insulin की वजह से anorexia है. So anorexia is there. So ultimately it all is presenting as severe weight loss, and severe weight loss in a cancer patient is known as cachexia. So this is the diagram of cachexia. Give me a thumbs up, everyone. If you got it, give me a thumbs up fast. So how cachexia is diagnosed? You are an oncologist now. How you will diagnose cachexia? There is one main criteria. If weight loss of the patient from the past 6 months, it is more than 5%. Initially, the patient's weight was just suppose 50 kg, and within 6 months after the diagnosis of cancer होना चाहिए ये 6 months में, ऐसे ही नहीं. So cancer होना चाहिए उसको, कोई ना कोई body part का malignant cancer होना चाहिए, और within 6 months from 50, 5% of 50 कितना होता है? 5% of 50 जितना भी kg होता है. So it is 2.5 kg, I guess. So patient is losing more than 2.5 kg in 6 months. So more than 5% of the weight loss. So that is the diagnostic criteria. What are the symptoms of cachexia? Diagnosis हो गया, now pathogenesis हो गया, diagnosis हो गया, coming on symptoms of cachexia. So what are the symptoms of cachexia? So patient will have unintentional weight loss. Number 1, unintentional weight loss, severe weight loss. Number 2, anorexia or loss of appetite. The definition of anorexia is loss of appetite. He don't like food. He don't like eating anything. You know the reason for all. Muscle wasting is there, skeletal muscle wasting, and decreased quality, lowered quality of life. Patient will be depressed like. So these are the 4 symptoms of cachexia. So cachexia is over. So 3 things I have told you about cachexia. What is cachexia? What is the pathogenesis of cachexia? What is the diagnosis of cachexia? And what are the symptoms of cachexia? Everyone give me a thumbs up. I want thumbs up from everyone, those who are listening. Should I move to the second symptom of cancer of neoplasia? Should I move? Everyone give me a thumbs up. Usme कंजूसी मत करो. Fast, fast. Okay, done. Okay, so cancer cachexia is over. Coming on the second symptom of neoplasia, that is fever. Now we know what is fever. Rise in body temperature is known as fever. We already know it. Exact mechanism why tumor associated fever is there is not known, but there are some probable theories. So it is caused by due to some pyrogens. Pyrogens are secreted by the tumor cells. Now listen, if a tumor is there in body, any tumor, head to toe, any tumor cell is there. So tumor cells secrete cytokines. We have seen it is secreting now interferon gamma, IL-1, many types of interleukins are there, and TNF alpha. So these are the inflammatory cytokines secreted by tumor cells, some of the tumor cells. So those inflammatory cytokines are secreted by tumor cells also, and inside tumor cells necrosis is also there. Very fast growing tumor cells have necrosis. What is necrosis? Necrosis is a type of cell death. 2 types of cell death is there, apoptosis and necrosis. In tumor, necrosis takes place. Why necrosis takes place in tumor? Because tumor is such a, the central portion of the tumor undergo necrosis. So this is a tumor. These are the tumor cells. It is a very fast growing tumor like Burkitt lymphoma. Some of the tumors are rapidly growing. So if it is rapidly growing now, so how blood supply to the tumor occurs? If any tumor is there, blood supply is from outside to inside. New blood vessels are formed. It is known as angiogenesis. Angiogenesis is formation of new blood vessels, but new blood vessels are formed from outside to inside. So new blood vessels are present outside the tumor. So they are supplying blood from outside to inside. So which cells, outer cells or inner cells, which cell will have less blood? So if the tumor is rapidly dividing now, so the central cells will have least blood. So these are more susceptible for ischemia, and because of ischemia they can die. They undergo necrosis. So tumors start necrosing from the center always. So this is the reason why tumors start necrosing. Necrosis start in the tumor from the center, not from the periphery. It always starts from the center towards the periphery. So that is the common sense. Now pathophysiology is there. Okay, got it. So it occurs only in rapidly dividing tumors. If it is not rapidly dividing, cells are moderately dividing तो है तभी तो tumor है, moderately dividing तो blood supply पूरा पड़ जाएगा, it is not deficient. लेकिन rapidly dividing है तो जो blood supply it is insufficient, then the central cells will undergo ischemia, and because of ischemia there is necrosis. Which type of necrosis? There are 5 types of necrosis, you already know: coagulative, liquefactive, caseous, fat, fibrinoid. Due to ischemia, which type of necrosis? Due to ischemia in any organ, which type of necrosis? Yes, necro. You are right. Krishna, you are also right. So it is coagulative necrosis. So my second question, listen my second question now. So coagulative necrosis is the necrosis which is due to ischemia. If any organ of the body not getting sufficient blood, cells of that organ die because of necrosis. That is which necrosis? Coagulative necrosis, except one organ, in which due to ischemia death is not due to coagulative necrosis, some other necrosis. Which organ? Except what? Yes, so necro, Nandini and Shri Kartik, you are right. So it is brain. Brain is the exception. In brain, if ischemia occurs, in brain or brain tumor, I'm talking about both normal brain or brain tumor. If ischemia is there, then of course ischemia की वजह से necrosis होगा, लेकिन not coagulative necrosis. Now my third question, which necrosis? Yes, before my question you have answered it. You are right. So it is liquefactive necrosis. So these are the things, basic things you should know. So why fever occurs? Let's come on the topic again. Why fever is occurring in tumor? Any tumor of the body, how fever is occurring? Let me correct my question. Why nahi? How? How fever is occurring? So tumor cells as well as necrosis inside the center of the tumor, both of them are secreting inflammatory cytokines. So tumor तो निकाल ही निकाल रहा है, उसके central portion में जो necrosis है, that is also secreting inflammatory cytokines. Which inflammatory cytokines? Enumerate them. Enumerate them. So inflammatory cytokines are interleukin 1, interleukin 6, interleukin 10, TNF alpha and interferon gamma. The same one, interleukins and TNF alpha और interferon gamma है. These are the cytokines. What they will do? They will secrete prostaglandin E2. Now this is the central in this pathogenesis. This thing is central. So prostaglandin E2 is secreted in the blood. In सबकी वजह से blood में आया. There are many type of prostaglandin. ना? You know E2, I2. So it is E2 वाला. So prostaglandin E2 is present in the blood. Via blood, this prostaglandin E2 will go in the brain. In brain, it will go to the hypothalamus. In hypothalamus, we have a thermostat. In hypothalamus, we have a thermostat. In that thermostat, in normal human being, the normal body temperature is set. Our normal body temperature is 98.6, whatever it is Fahrenheit, it is set there. But it will increase the threshold there. It will decrease the threshold there. So patient's temperature will increase and patient will present as fever. So this is the mechanism. And these cytokines also go to the liver via blood, and liver will secrete C-reactive protein that will also elevate the temperature of the body. So these two are the mechanism for fever. Have you got it? Have you got it? So central to this is prostaglandin E2, on which any time a new MCQ can be framed and it can come in your exam. So prostaglandin E2 is causing fever. Done. Have you got it? So patient will have new set point will be there in the hypothalamus. New temperature set point will be there. So normal, instead of 98, it will be set at 100, 101, 102. So patient's body temperature will become rise. So that is the new temperature set is there. Because of these are known as pyrogens. So that is TNF, IL-1, IL-6, all of them are pyrogens because they are secreting prostaglandin E2, and that is causing new set in the hypothalamus. Done. So that is the second thing. So we are done with cancer cachexia. Yes. We are done with fever. Say yes, son. Done. Yes, for COVID, the mechanism is same. For fever, the mechanism is same everywhere. Done. So whatever you talk, whether tumor or whether any other condition, prostaglandin E2 is increasing the thermostat in the brain, in the hypothalamus. The third condition, very, very important, tumor lysis syndrome, TLS, tumor lysis syndrome. After that, I will come on PNS. So what is tumor lysis syndrome? First thing, what is tumor lysis syndrome? Second thing, in which tumor this syndrome occurs? Name the tumors. Name the tumors. Number 3, what are the clinical features of the syndrome? So just answer these 3 questions. First thing, what is tumor lysis syndrome? Now, as I have told you, there are some tumors in which the cells rapidly proliferate, like Burkitt lymphoma, very rapidly proliferate. So in such tumor, this syndrome occurs. Because jitni jaldi cell proliferate hoke banega, utni jaldi marega bhi na. So the tumors in which cells proliferate very rapidly, cells die also very rapidly. जितना जल्दी बनेगा उतना, क्योंकि cells will become too much na, and blood supply will not be sufficient. So from the center, cells start necrosis, cells start dying. So rapidly proliferating tumor, if some tumor is there and the cells of which are very rapidly proliferating. They are dividing, and dividing. So blood supply, this is the blood supply. This is blood vessel. So blood supply is not sufficient. So cells present at the center start dying. So rapidly dividing tumor have cell death, extensive destruction of large number of cells. So जो rapidly divide करेगा उसमें rapidly destruction भी होगा. That is a rule. जो जितना आएगा उतना जाएगा. Done. So it is always a balance of the nature. Done. So in such tumor lysis syndrome occurs. So what will happen? The tumor, the central cells, the cells present at the center of the tumor, they will die. They will burst out. In necrosis, cell membrane is not intact like apoptosis. In apoptosis, cell membrane is intact. But in necrosis, cell membrane burst and all the components inside the cell will come in the blood. So in the blood, क्या आ जाएगा? सारे cell destroy हो जाएंगे. They will burst out at the center. So उसमें क्या आएगा? What will happen? Blood vessel में क्या आएगा? Cell burst out. When cell will burst, what will come in the blood? In the blood, what things will come? What things will come? Number one, nucleus is made up of purine and pyrimidine. So the nucleus will burst. All the cells, nucleus will burst. The purine and pyrimidine present in the nucleus will convert into uric acid, will metabolize into uric acid. So blood uric acid level increases drastically. Number one, patient will present with gout. So because of increased uric acid, patient will have multiple joint pains. Number one, gout is there. Number one. Number two, all the cells have potassium in the cytoplasm. When the cell bursts after dying, after necrosis, the potassium will come in the blood vessels. So patient will present with hyperkalemia and it will cause arrhythmia in the patient. So uric acid बढ़ गया, joints में pain हो रहा है. Potassium बढ़ गया, तो arrhythmia हो गया. Done. So that is hyperkalemia. Hyperuricemia causing gout. Hyperkalemia causing arrhythmias. Number two. Number three, cytoplasm of the cells also have phosphate, abundant of phosphate. So when the cells burst, all the phosphate is coming in the blood. So hyperphosphatemia. Number three, hyperphosphatemia. Number three, hyperphosphatemia. And this phosphate, after coming in the blood, will bind with the calcium present in the blood. So calcium level will fall because it will form a complex with phosphate as calcium phosphate. So hypocalcemia. So four things. What I have told you: hyperuricemia, hyperuric acid, uricemia, hyperkalemia, hyperphosphatemia. Because of hyperphosphatemia, hypocalcemia. Now don't get confused. Hyperkalemia है और hypocalcemia है. अंतर है ना? There is a difference. Give me a thumbs up if you got it. So these are the four features of tumor lysis syndrome. So patient, imagine a patient having such a tumor which is rapidly dividing, very rapidly dividing. So cells will die from the center. In that tumor, from the center, cells will start extensive destruction. When the cells will burst, tumor cells are bursting. So three things will come out of the cell in the blood vessel. Number one, uric acid. So uric acid, patient will present as number one, gout. Uric acid will cause gout. Number two, uric acid will go in the kidney and cause acute renal failure. So patient will present with ARF also. Oliguria. Patient is presenting with oliguria, acute renal failure, ARF. So this is because uric acid will form crystals in the bones. So it is causing gout. It will form crystals in kidney also. So if it forms crystals in the kidney will fail. So acute renal failure. Rato rat oliguria mein patient पहुंच गया. It is an emergency condition. Done. Hyperkalemia, because potassium is also coming from the cell. When the cells is bursting, this is a cell. It is bursting. So all the things present in the cell will come in the blood. So nucleus is made up of purine pyrimidine and it will convert into uric acid. Cytoplasm contains potassium. It will come in the blood. So this potassium present in the cytoplasm, it will come in blood causing hyperkalemia. It will result in arrhythmia of the heart. So patient can present with arrhythmia. It is an emergency condition. Patient can die with arrhythmia. So it is emergency. Although cancers are non-emergency. You say cancer is a chronic disease. It is not an emergency. So उसका treatment तो 1-2 साल चलेगा, like chemo, radio सब होगा. So it is not an emergency situation, but arrhythmia can be emergency. Yes or no? Acute renal failure can be emergency. Done or not? And the third thing which is present in the cytoplasm is phosphate. So all the phosphate from the cell, when the cell bursts, it will come in the blood. So patient present with hyperphosphatemia, and in the blood this phosphate forms a complex with calcium. So free calcium in the blood will decrease. So hypo में एक ही चीज है, hypocalcemia. So calcium will decrease. So 3 hyper है, 1 hypo है. And name the tumors. Name 4 tumors which show abundant proliferation. क्योंकि जिनमें abundant proliferation होगा, उसी में extensive destruction भी होगा. Do you understand Hindi? All of you understand Hindi, na? Yes or no? Okay, I will say in English also. So whatever tumors showing extensive proliferation, they only show extensive destruction. So these are the 4 tumors which show extensive proliferation. Yes, high KI index, you can say. KI 67 index is the index for, it is a marker for mitosis.
Yes, you can say. So Burkitt lymphoma, number 1, Burkitt lymphoma, number 2, ALL. There are 4 types of leukemia, na? So acute and chronic myeloid lymphoid, ALL, AML, CLL, CML. So out of it, it is ALL and CLL, chronic tumors also blood case. So leukemias and uncommonly solid tumors also. So these are the examples. And what things are there? I have already explained hyperuricemia. Tell me the reason why hyperuricemia. Who will tell me the reason? Due to increased turnover of nucleic acids. Nucleic acids, purines and pyrimidines are there. Hyperuricemia, the uric acid will precipitate in the kidney. It will cause acute renal failure. Patient can present with oliguria, anuria, acute renal failure. Done. Number 2, you know the stages of acute renal failure, stage 1, 2, 3, 4. Yes or no? The second is hyperkalemia. All the potassium will come in the blood. It will cause abundant. It is due to abundant intracellular cation potassium present in the cytoplasm. It will result in arrhythmia. Number 3, hyperphosphatemia. So intracellular phosphate will come in the blood. And hypocalcemia. So phosphate will form a complex with the calcium. So 3 hyper है, 1 hypo है. Hyper क्या है? Potassium hyper है. Uric acid hyper है. It is hyper. Phosphate hyper है. लेकिन calcium hypo है. You will never forget. Say yes or no. Everyone say yes or no. What are 3 hyper and 1 hypo? Tell me 3 hyper and 1 hypo. Look at the arrows. 3 hyper, 1 hypo. Who will tell me? Tumor Lysis syndrome. 3 hyper, 1 hypo. What are the hyper? 3 hyper क्या है? 3 hyper क्या है? Number 1, uric acid. Hyperuricemia. Number 2, potassium. Hyperkalemia. Number 3, phosphate. Hyperphosphatemia. Number 4, hypo. Hypo is calcium. तो hypocalcemia. ये कैलीमिया है, ये कैल्सीमिया है. कैलीमिया, कैल्सीमिया. Don't get confused. Calemia means potassium. Calcemia means calcium. Done. So these are the reasons. The same flowchart. So done with tumor lysis syndrome. I guess everyone understood it. Done or not? So tumor lysis syndrome. This is a tumor. Tumor cells are bursting. They are bursting. So potassium coming out, causing arrhythmias. Nucleic acid come out. So purines and pyrimidines will get converted into uric acid. Uric acid will go in kidney, form crystals, and it will result in acute renal failure. So heart gaya, kidney gaya. Potassium will come in the blood. So hyperphosphatemia, form a bond with calcium. So calcium will decrease. Done. And calcium will decrease. And fluid retention is there because of acute renal failure. Done. So fluid retention in the body. Same flowchart. Again and again, the same flowchart with different things. So whatever flowchart you write, you can write in your exams. Should I proceed? We are done. We are done with the local manifestations. We are done with 3 of systemic manifestations of tumor. I am teaching you clinical features of general neoplasia, not any specific tumor. General neoplasia के clinical features क्या होते हैं? So the first was cachexia. You know what is cachexia? What is the mechanism of cachexia? How it is occurring? What are the diagnosis? How you diagnose cachexia? What is the diagnostic criteria? If any patient is losing more than 5% of weight, 5% of the weight, more than 5% of the weight in last 6 months after having cancer. So patient is said to be cachexic, and you know the symptoms of cachexia. So cachexia is over. You know how fever takes place in tumor. What is the mechanism? How in the hypothalamus the thermoset is reset. So it is the fever, mechanism of action of fever. Coming on the third thing, tumor lysis syndrome. You know what is tumor lysis syndrome? You know 3 hyper and 1 hypo in tumor lysis syndrome, and you know why it is occurring, the reason. And you know the tumors in which tumor lysis syndrome सब में नहीं होता है, सिर्फ 4 ही tumor में होता है. You know the name of it. The most important is Burkitt lymphoma. So the tumors which are rapidly proliferating. Coming on the last but not least, paraneoplastic syndromes. Done. So should I start paraneoplastic syndrome? Give me a thumbs up if you people are enjoying with me, not sleeping. How I will know whether you are sleeping or not? So just say something in between, ask something. If you are there, give me a thumbs up. Done. So interact with me. Otherwise, you can watch the recording also, no, later on. It is not a recorded lecture. It is a live lecture. Yes or no? So interact with me. So coming on the last thing, paraneoplastic syndrome. What is paraneoplastic syndrome? Does anyone know what is paraneoplastic syndrome? Does anyone know? I will teach you, but does anyone know what is paraneoplastic syndrome? It's a very important topic for MCQs. Many MCQs come from this topic. Very important, high yielding topic. But very few students understand the meaning of it. No, Shri Karthik, it is not the precursor. It is not that. The name, the meaning is hidden in the name only. If you split the name, paraneoplastic, you will get the meaning. I will tell you the meaning. Okay, just give your guesses first. So Paraneoplastic syndrome. It is a difficult topic to understand. Now, from student point of view, it's okay. I will explain you. You will understand it. You will crack your MCQs also. You will write in your university exam also. You will pass the exams. Okay. But being a doctor, when you practice oncology, nowadays the prevalence of oncology is too much. You know, the cancer is increasing in such a drastic rate in the society. We see cancer patient in almost every house, every home. So it is increasing drastically. So oncology branch is proliferating like, you know, fire. So most of the doctors, the sprouting new doctors, they choose oncology as a branch. Many of you want to become, I'm damn sure you want to become, many of you do want to become oncologist, either medical oncologist or surgical oncologist. Yes, so the two type of oncologists. For that, you have to do DM and MCH. Although MD is not sufficient, MD and MS. So after doing your MD or MS, the 3-year more study, you have to do MCH or DM for becoming a onco specialist. Yes or no? By the way, I'm an oncopathologist. I practice pathology only in oncology. So because I have done my MD from Tata Memorial Hospital, Mumbai. That is the most apex institute for oncology. So I have done my specialization in oncology, the benign and malignant. So tumors are my favorite, you know. So anyways, so there can be medical, surgical, pathological oncologists. So I'm a pathological oncologist, you can say. So anyways, so paraneoplastic syndrome. So in clinical practice, also diagnosing paraneoplastic syndrome in a cancer patient is like a challenge. So listen, the meaning. Paraneoplastic syndrome. Just suppose, imagine a situation, some person is having lung cancer. So patient is coming to you, you are clinic, you are a doctor. Patient is coming to, just a second, patient is coming to your clinic. So patient won't say, doctor, I'm having lung cancer, treat me, give me chemotherapy, radiotherapy, operate me, I'm having lung cancer. No, patient won't say that. What the patient say? Patient will tell you the symptoms. Doctor, I'm having cough, I'm having dyspnea. So you will diagnose, okay, what is the system? Which system is involved? CNS, CVS, RESP, GIT, blood. First you diagnose the system. In system, what may be the disease? What are the differential diagnosis? 1, 2, 3, 4, 5. So you will order some test, some CT, MRI, X-ray, whatever, some blood test. So you will order a panel of tests, and based on your judgment, your knowledge, your differential diagnosis, and the results of those tests, you will come to a conclusion that the patient, you are having this disease, Mr. Mrs. You are having this disease. So that is the approach. Yes or no? Imagine a patient. So what do you expect? A lung cancer patient, you are an oncologist, or simply a general physician. So a patient is coming to you. A lung cancer patient should present with what complaint? What complaint? He should complain of what? So in your mind, you can click, no, he or she may have lung cancer. What should be the symptoms? What should be the symptoms? I'm asking to you. लंग कैंसर पेशेंट किसके साथ आना चाहिए? सिम्टम क्या होगा उसका? तुम्हारे पास आके पेशेंट क्या बोलेगा? डॉक्टर साहब तकलीफ क्या है? Whenever patient comes to you, you write the name and age. The first question you ask to the patient, क्या तकलीफ है? भाई साहब, बहन जी, मैडम, sir, what problem you are having? What are your symptoms? Why you are there in front of me? So dyspnea can be there, cough can be there. Okay. So if any patient is coming to you with dyspnea, with cough, you will ask whether you are a smoker or not. You will take a history also, not appropriate. So patient is a chronic smoker, heavy smoker. So you will have a doubt. He's a middle-aged male, just suppose. So all the things are favoring towards lung cancer. Yes or no? If a gastric tumor, stomach tumor patient is in front of you, so he will complain loss of appetite or vomiting with blood in the vomiting. So these can be the symptoms you can expect. So whatever symptoms patient is telling you, so it is helping in differential diagnosis in your mind. Yes or no? Yes, no? Yes or no? If some patient is coming to you with some skin lesions, having some hyperpigmentation over the skin here and there, can he have lung cancer? He is not complaining of cough. He is not complaining of dyspnea. I'm having a hyperpigmentation here, there, and you are a dermatologist and he's coming to you. Why it is there? With the cosmetic purpose, I'm coming, it is a dark black patch is there. So yes, the patient can have lung cancer. So sometimes patient presents to us with unusual complaints, unusual symptoms, which are not related to the primary tumor. Primary tumor lung के अंदर है तो skin से क्या लेना देना? Lung का complain करो ना. You complain of cough, you complain of dyspnea. Patient is not complaining. Tumor is too small to produce cough. Tumor is too small to produce dyspnea. It is not producing. And metastasis, you will think, so why symptoms are coming in the skin? Why symptoms are coming in the skin? You will say, मैं metastasis होगा. Metastasis हो सकता है ना distant organ में. No, it is not related to the metastasis also. Lung cancer never go to the skin. No, it is not related to the metastasis. So neither the symptom is related to the primary tumor, nor the symptom related to the metastasis. Still symptoms are related to the cancer only. So being a doctor, you should know the panel of these symptoms. So if any patient is coming to you with this symptom, it is known as paraneoplastic. Para यानी आसपास, आसपास. Para यानी not exact the center, लेकिन center के आसपास को कहते हैं para. So paraneoplastic. So patient is complaining not of neoplasm, the symptoms related to the neoplasm. उसके आसपास के दूसरे symptom के साथ आपके पास आया है. But वो बेचारे को क्या पता कि मुझे ट्यूमर है. Diagnosis बनाना आपका काम है, patient का नहीं. Yes or no? So you should know कि these symptoms are related to this cancer. So I will tell you a list of the symptoms or a disease. Patient is coming to you with Cushing syndrome. Patient is fat, central obesity, moon face. You know Cushing syndrome. So Cushing syndrome के साथ patient आया. Can you think of any malignancy? Yes, patient have pituitary carcinoma or some other lung cancer can also be there presenting with Cushing syndrome. I will tell you reasons also why it is happening, because tumor is secreting certain hormones or proteins in the body producing that symptoms. So tumor itself in that organ is not producing symptom. Tumor में से कुछ निकल के blood में जाके वो symptoms आ रहे हैं, and patient is coming to us with that secondary symptoms. So primary की वजह से symptom नहीं है, metastasis की वजह से symptom नहीं है, symptom कुछ अलग ही है. तीसरा, so you should know, being a doctor, should you know these symptoms? Yes or no? Otherwise you will miss it now. And missing malignancy is like a biggest sin in this world. I believe. I have worked in Tata Memorial and I have seen many. I have worked there for 5 years and I have seen tremendous many, I can't say the number, many patients coming with stage 4. You know, stage 4 is inoperable, incurable. So when we ask the patient why you are here at such a late stage, so you were not knowing your diagnosis. So they always answer that we know the diagnosis since last 2 months, 3 months, 5 months. So in 2, 3, 5 months में तो पूरा खेल हो जाता है. So we were knowing that we have tumor, we have cancer, and किसी local physician ने या तो diagnosis में गड़बड़ किया, या तो किसी बाबा और that quack practice उसने गड़बड़ किया. So it is the biggest sin now. You have lost a life because of some mistake. You don't have right to lose a life. Yes, you are not God now. You are secondary to God, but not God. So you can't miss malignancy. So you should know all these symptoms of the patient. If some patient is complaining something about I will give you the list. So something about the paraneoplastic syndrome. So it should click in your mind कि ठीक है, Cushing syndrome primary भी हो सकता है, लेकिन Cushing syndrome lung cancer में भी तो होता है ना. तो let me check that also. Chest X-ray ऐसे ही करा लो. Patient बोलेगा chest X-ray का क्या लेना देना, मुझे तो skin में गड़बड़ है. नहीं, आप करवा लो, lung cancer में भी ये हो सकता है. So you should know it. Done. So that is the paraneoplastic syndrome. Give me a thumbs up if you people are with me. If you got it, what I mean, practically also, I'm more diverted towards practical aspect of it, because diagnosing paraneoplastic syndrome is a challenge, as I have told you. Yes, so you can't miss malignancy, no? You can't miss malignancy. तुम dermatology condition में घूमते रहोगे कि ये क्या है, ये acanthosis nigricans है, ये है, वो है, but it is a malignancy. अंदर छुपी हुई है, it is latent till now. जब तक उसके symptoms आएंगे, कफ और डिज्नी आएगा, तब तक वो stage 4 हो जाएगा. So you can't miss it. You want to detect it early. So knowing paraneoplastic syndrome is a must for you. Done or not? Done or not? Okay. So para means आसपास. Neoplastic यानी tumor के आसपास के symptoms आएंगे. So what is the definition? It is a group of condition developing in patients with advanced cancer in which neither the symptoms are explained by direct tumor nor the symptoms are explained by metastatic or distant spread of the tumor. So patient will give us some अलग ही symptoms, some different symptoms. Neither they are explainable by direct nor they are explainable by distant spread. Lung tumor में primary complaint कफ और dyspnea होनी चाहिए. He is not complaining of cough, he is not complaining of dyspnea. Lung में secondary वो brain में जाता है. Most commonly lung tumor goes to the brain. So he is not complaining of any of the CNS symptom, headache, seizures, कुछ भी नहीं है उसको. तो न तो primary की complaint है, न तो metastatic की complaint है. मुझे primary भी पता है, metastasis भी पता है. Patient is complaining कि मुझे skin में dermatitis है या some other complaint है. Hypercalcemia है, hypoglycemia है. So these are the complaints of the patient. So I can relate it to the lung cancer if I know this. Done. So that is only 10 to 15% of the patient presents with advanced cancer present with paraneoplastic syndrome. And sometimes PNS, paraneoplastic syndrome, is the earliest manifestation of the cancer. That is the dangerous thing. Patient is not complaining of primary and metastatic disease. He is complaining of paraneoplastic syndrome. So paraneoplastic syndrome से पकड़ के आपको retrograde पीछे जाके उसका cancer detect करना है. So that is a challenge. Yes. So paraneoplastic syndrome is a disease, or it is a symptom. It is a symptom that is due to the consequence of cancer, but not due to the presence of local cancer cells. Done. Have you got it? Give me a thumbs up if you got this definition. Everyone give me a thumbs up. Those who are listening, I want thumbs up from each and every of you. If you understood it, then only I will proceed. Okay, so why it is happening? As I have told you, when tumor cells, when any tumor is present in any human body, so this is a tumor, these are the tumor cells, body will form antibodies against the tumor cells. It is a foreign material, na? So these antibodies will destroy the tumor cells, okay, but these antibodies will cross-react with some other organs in human body that can produce the symptoms, number one reason. So cross-reacting antibodies, this can be the reason, number one. Number two, this tumor is secreting certain hormones or certain proteins from it, and these hormones and proteins are going in the blood and producing various symptoms. So production of physiological active factors or production of metabolic pathways alteration, so that may be the reason for these symptoms. So let me start the classification, then I will give you detail of some important classification. ही बहुत बड़ा है, डिटेल हम सिर्फ कुछ की पढ़ेंगे जो important है, जो तुम्हारे syllabus में है. Done. So let me start with endocrine system. So let me tell you some complaints of endocrine system, endocrine syndromes. There can be patients present in your clinic presenting with hypercalcemia. What is the normal blood calcium level? Calcium level normal कितना होता है? 9 to 11 milligram per deciliter. If you do a calcium level, calcium phosphate level, you do electrolyte level, ना? एक electrolyte करवा लो blood में, serum में, you know. So आपने calcium करवाया किसी patient का, and patient is presenting with hypercalcemia. Patient is presenting with hypercalcemia. It can be lung cancer, it can be kidney cancer. Lung and kidney are most commonly causing hypercalcemia. It can be breast cancer, and it can be ATLL, that is acute T-cell leukemia. Done, lymphoma or leukemia. Done. So these four cancers presents with hypercalcemia. Why? Know the reason first. Why? Because the tumor cells, these tumor cells secrete parathormone from them. Parathormone nahi, parathormone-like substance. Parathormone-like substance is secreted from them, and you know parathormone increases calcium concentration in the blood. It dissolves the bone and it increases the absorption of calcium from the blood. PTH, yes, parathormone-like hormone substances are secreted and it will cause hypercalcemia. That is the reason. Second, there may be, imagine a patient entering in your OPD, in your chamber, in your clinic with Cushing syndrome. Looking at the patient, you will identify his Cushing syndrome. He's having a buffalo hump, he's obese, he's having a moon face, typical Cushing syndrome, you know. Patient is with Cushing syndrome, he may have lung cancer. He may have, so always ask a chest X-ray in such patient. In such lung cancer, most commonly causes Cushing syndrome. Which lung cancer? You know the classification of lung cancer. There are 4 types of lung cancer: squamous, adeno, large cell, small cell. So it is small cell wala. So small cell carcinoma of the lung. Done. Pancreatic and neural also, but mainly lung cancer. Why? Because the lung cancer secretes ACTH-like substance in the blood, and this excess of ACTH is leading to Cushing syndrome. So it is not actually ACTH. ACTH-like substances secreted by the tumor cells. Give me a thumbs up if you got it. Give me a thumbs up. Third is SIADH. SIADH. You know SIA, inappropriate antidiuresis. SIADH. You know IDH. So it is inappropriate secretion of the ADH hormone. ADH hormone is secreted from posterior pituitary. So patient will present with the concentrated urine, less urine, concentrated urine, and all the water is retained in the body. So volume in the blood will increase more than 5 liters, and osmolarity of the blood will decrease. So these are the symptoms of SIADH, you know. So patient will present कि मुझे बहुत कम urine आता है. If you analyze the urine, it is concentrated. If you see the plasma, it is hypoosmolar, and urine is hyperosmolar. Urine ज़्यादा concentrated है, blood कम concentrated है. That is SIADH. Because more ADH is secreted by the tumor cells. Which tumor? Again lung cancer. So lung cancer is the deadliest. Lung cancer कब से कम present करेगा, इन सब के साथ ज़्यादा present करेगा. So lung cancer patient can come to your clinic with hypercalcemia. He can come with Cushing syndrome. He can come with SIADH. So these are the variable symptoms which patient is presenting to you. So always do a chest X-ray. कि एक middle aged male है, smoker है. I'm sorry. और साथ में Cushing syndrome, SIADH या कुछ ना कुछ है, तो do a chest X-ray ना, करवा तो लो, कभी निकल गया लंग कैंसर तो मे भी ना हो, सच में उसको हाइपरकैल्सीमिया, Cushing और SIADH हो. ये पैरानियोप्लास्टिक वाला नहीं भी हो सकता है, बट हो भी तो सकता है. Done. So this is the thing. The fourth is hypoglycemia. So patient will present चक्कर आ गया. Hypoglycemia में क्या होता है? Patient will present as tremors, चक्कर आना. You know ना, diabetic patients sometimes due to insulin overdose they go in hypoglycemia. So palpitation, tremors and dizziness. चक्कर खा के गिर जाएंगे और कोमा में, they can go in coma. So hypoglycemia can be a feature for pancreatic tumor, islet cell tumors of the pancreas, mesothelioma and fibrosarcoma, because they secrete insulin from them. So insulin overdose हो गया. So because they secrete insulin-like substance from them. And last is Carcinoid Syndrome. Carcinoid Syndrome. Carcinoid Syndrome, there are some tumors, especially bronchial Carcinoid Syndrome, again lung tumor. They secrete serotonin from them, which is causing flushing of the face. Face एकदम लाल हो जाएगा, severe sweating, बहुत पसीना आएगा. That is Carcinoid Syndrome. Carcinoid Syndrome. And last is polycythemia, anemia का उल्टा, normal hemoglobin level in male female 11 to 13 gram, you know hemoglobin. So 11 से कम है तो anemia है, 13 से ज्यादा है तो polycythemia है. So polycythemia can be there in renal tumors, renal, kidney, because kidney secrete erythropoietin. Tumor में erythropoietin कुछ ज्यादा ही बनेगा and erythropoietin से bone marrow में more RBC production. So more RBC production, more hemoglobin production, that is polycythemia. Done. So these are the 6 endocrine features of paraneoplastic syndrome. So what patient is complaining to you? Patient आपके पास in complaint के साथ आया है. जैसे ही patient in complaint के पास, you are a doctor, in complaint के साथ patient आया, या तो hypercalcemia, या तो Cushing syndrome, या तो SIADH, या तो hypoglycemia, या तो carcinoid syndrome, या polycythemia. ऐसा नहीं polycythemia तो अच्छा hemoglobin तो बहुत ज्यादा है. No, it can be cancer. So rule it out. Before complimenting the patient, rule it out. एक patient का CBC देख के hemoglobin 16-17 है, don't कि हाँ बढ़िया hemoglobin चल रहा है, आपको तो normal से भी ज्यादा है. It is polycythemia. It can be renal cancer. So just do a sonography or just do a CT scan. So just rule it out, whatever investigation you want. So whatever best investigation appropriate for the patient, depending on the budget, age, and many things. So you just order that investigation and just be sure it is not malignancy, it is not paraneoplastic syndrome. So any patient presenting with any of these symptoms, तुम्हारे दिमाग में ये सारे कैंसर आने चाहिए कि ये कंडीशन इसमें होती है, ये इसमें होती है, ये इसमें होती है, ये इसमें होती है, ये इसमें होती है. You should know the mechanism also, and depending on that, you order a panel of tests to the patient to rule it out, to rule the malignancy. Give me a thumbs up if you got it. Give me a thumbs up fast. So these 6 endocrine conditions are most important paraneoplastic syndrome. Can you enumerate the 6? Can you enumerate the 6 and can you tell the which cancer, which one is present? Mostly lung cancer में है 3-4 तो इसमें से 3 or 4 are present in lung cancer only. So you know the 6 conditions. We will talk about them in detail one by one. These endocrine, so I will teach you all endocrine in detail. 6. Coming on neurological manifestation, myasthenia gravis or neuromuscular disorders. Now, myasthenia gravis and thymoma. Typically in thymoma, myasthenia gravis will present. And you know there are osseous joint soft tissue related symptoms. There can be hematological syndromes. There can be cutaneous. I was talking about. Patients usually come to a dermatologist. So if you want to practice dermatology, ना dermatology can be your dream branch. You know, आजकल dermatology top पे चल रही है, radiology top पे चल रही है. So if you want to practice dermatology, sometimes patients come to you with acanthosis nigricans. So he will have necklace-like patch there. So it is typical acanthosis nigricans, but he can have stomach cancer. So it is a secondary finding. It is due to immunological. Body is forming antibodies against the tumor. So tumor cells are destroyed by that antibodies, but that antibodies are destroying the skin also. So that is immunological reason. Have you got it? It can be seborrheic dermatitis. That is dandruff. Patient can come with you dandruff. He can have malignancy. अब किसी patient को dandruff है, तुम उसको बोलो नहीं तुमको तो cancer intestine का. Patient will slap you. He will run away. The doctor is mad. Don't go to this doctor. So just explain it. सीधे नहीं बोलना है dandruff है तो tumor है. Dandruff है तो tumor हो सकता है नहीं. So just rule it out. Have you got it? Have you got it? So this is the fun with paraneoplastic syndrome. Patient is coming with something, you are telling patient something else. Done. So there is no correlation between the two, but you should know the correlation. Give me a thumbs up if you got my point. Now, seborrheic dermatitis, patient will come to you with dandruff, and it can occur in bowel malignancy. It can occur. Otherwise, simple dandruff भी हो सकता है. So you just rule it out. कि वैसे तो simple ही है, लेकिन 1% chance you may have malignancy. To rule it out, just do a sonography. Just do a sonography. So you have to consult the patient. सीधे नहीं बोलना है कि नहीं ये dandruff नहीं तो tumor की वजह से. Patient will run and he will never come, and it will give bad marketing, bad publicity to your name. कि doctor तो पागल है. Done. The doctor is mad. So this is the thing. Done. So these are the paraneoplastic syndrome. You know the classification. Among all these, the most common tumor which presents with paraneoplastic syndrome is small cell carcinoma of the lung. जो main complaint से कम paraneoplastic से ज़्यादा आता है patient. So small cell carcinoma of the lung is the most common tumor which presents with paraneoplastic syndrome. Among the all paraneoplastic syndrome, most common paraneoplastic syndrome is hypercalcemia. Among the tumors, most common tumor is lung cancer, small cell carcinoma of the lung. Among the paraneoplastic syndrome, most common paraneoplastic syndrome is hypercalcemia because of parathormone-like substance release. So, and second most common, from endocrine most common it is Cushing. So Cushing is most common endocrinopathy. Give me a thumbs up because of ACTH-like substance release. Everyone give me a thumbs up. If you have any doubt, in this introductory part, please ask your doubt. I'm open to address it. Otherwise, I will give you the description, small description of these. Then I will launch polls, very interesting polls. Fast. You have any doubt? Otherwise, give me a thumbs up now so I can proceed. I'm waiting for your response. So endocrine mein there are 6 things. We will discuss them one by one in short. So the first thing I am going, these are the endocrine. The endocrine mein first thing I am discussing is Cushing syndrome. So imagine a patient coming to your clinic. He is the patient. He is, as soon as the patient entering in your chamber, in your OPD, you will identify his Cushing syndrome because he is having moon face, he is having buffalo hump, and he is having truncal obesity. He is having thinning of the scalp hair. So you know the reason. You have already studied Cushing syndrome in physiology and in multiple subjects. Now you already know what it is. It is due to excess of ACTH. Normally ACTH is secreted by the adrenal gland. Here ACTH is not secreted by adrenal gland. ACTH is secreted by the pituitary adenoma. ACTH secreting pituitary adenoma. Patient is having pituitary adenoma or patient is having ectopic ACTH secretion like small cell carcinoma lung, pancreatic tumor, thyroid tumor, or thymoma. So these 4 tumors also secrete ACTH-like substance. So these, learn the name of the tumors. Learn the name of the tumors. Learn the clinical features. These are the clinical features. So patient is coming to you with these clinical features. You can say it can be simple Cushing syndrome or it can be paraneoplastic Cushing syndrome. If it is simple Cushing syndrome, no need to fear. We will treat it. If it is paraneoplastic Cushing syndrome, along with Cushing syndrome, we have to treat your tumor also. Tumor is hidden in you. Now, which tumor? Patient will ask you, which tumor I can have? You can have small cell carcinoma lung, you can have pancreatic tumor, thyroid tumor, or thymoma. These 4 tumors can also present with Cushing syndrome along with normal Cushing syndrome. So that you have to counsel your patient. How you will diagnose? You do 24-hour urinary pre-cortisol. Done. And you know challenge test. So you have already studied it. So based on it, you will diagnose it. And treatment, treat the cause, treat the malignancy. Treat the malignancy, do the surgery of that tumor. Whatever tumor is presenting, do the surgery. Tumor remove karoge, so ACTH concentration automatically reduce, Cushing syndrome automatically treated. Give me a thumbs up, everyone. So that is the treatment of the first thing, Cushing syndrome. I'm done with the first paraneoplastic syndrome from endocrinopathy is Cushing syndrome. Second, I am coming. Cushing syndrome ho gaya. I'm coming on SIADH. The second, I'm starting SIADH. So SIADH is syndrome of syndrome of inappropriate ADH secretion. Syndrome of inappropriate ADH secretion, antidiuretic hormone secretion. So you know what is antidiuretic hormone? Where it acts? You know kidney. Or of course, you know kidney. Humans have a pair of kidney. Inside the kidney, the functional unit of the kidney is a nephron. You know the 5 parts of the nephron. So you know the 5 parts of the nephron. It is glomerulus, it is PCT, it is loop of Henle, it is DCT, it is collecting tubule. So ADH acts on collecting tubule. Again, important MCQ. So these are the cells of the collecting tubule. This is the collecting tubule. These are the cells of the collecting tubule, and around it, vasa recti is present. Blood vessel is present around it. So this is the blood vessel present around it. Yes or no? So ADH is present, excessive. So anywhere you are having tumor in the body, just suppose you are having tumor where, let me enumerate the tumor. Which tumor causes it? So again, small cell carcinoma of the lung, SCLC, pancreatic tumors, lymphomas, non-Hodgkin's lymphoma, and squamous cell carcinoma of the head and neck. So these tumors secrete ADH. Listen, see in this diagram. Just suppose the patient is having any of this tumor. This is the tumor. Either it is lung tumor, pancreatic tumor, non-Hodgkin's lymphoma, squamous cell carcinoma in the mouth. So whatever tumor it is, the tumor is secreting ADH. So this green color is the ADH, and this ADH is entering in the blood. So it is going in the kidney. It is going to the collecting tubule of the kidney, this ADH. So the receptors for ADH are present in these cells on the ADH. So ADH will enter in these cells, collecting tubule cells. Listen, it is important. I'm trying my best. So ADH will enter inside these cells, and what it will do? There are some channels which are known as Aquaporin 2 channels, which are present inside these cells. So they will what they will do? They will mobilize the Aquaporin 2 towards the junction, towards the basement membrane of these cells. So what this Aquaporin 2 will do? How I will explain you. So they take the water from the lumen into the blood. So all the water present here in the lumen of the collecting tube, which was about to be excreted in the urine, it is reabsorbed in the blood. So very less water is excreted in urine. So urine is hyperosmolar. Concentrated urine is there. And blood में सारा पानी चला गया. So blood की osmolarity reduce and blood का volume increase. So these are SIADs. Give me a thumbs up. So this is the diagram. This cell is cell of collecting duct. Can you see the cell in this diagram? This is a cell of collecting duct. This is a cell. See, I'm highlighting it. This is the cell. So on one side of this cell, can you see? This is the lumen containing urine. On other side of it, this is a blood vessel. So can you see this ADH? ABP and ADH, one and the same thing. It is present in the blood. It is secreted from some of the tumor. So it is coming here, it is binding with its receptor, and these are the aquaporin channels. Aquaporin channels are mobilized because of its binding, and they are channelized on the basal membrane, basement membrane, and because of which all the water, can you see the water here? Water is entering inside. All the water present in the urine is transmitted to the blood. So urine में water कम हो जाएगा और blood में water, urine में water कम हो जाएगा, blood में water बढ़ जाएगा, because of which is known as SIADH. So patient comes to you with decreased water in urine, urine concentrated, and hypoosmolar, blood की osmolarity कम हो जाएगी, that is less concentrated plasma. Done? Give me a thumbs up. Give me a thumbs up. So it is due to this. Number one, this is the reason. You know the tumors which are presenting with it. Clinical features: excessive volume, hyponatremia. So all the water is entering in the blood. So what is the harm? So potassium concentration in the blood will decrease. Potassium, आप बोलोगे कि नहीं, sodium concentration will decrease. Sodium तो normal है ना, वो क्यों कम होगा? Sodium normal है, लेकिन पानी ज्यादा मिल गया तो relative hyponatremia. So patient will present with relative hyponatremia, hypoosmolarity of the plasma, or urine sodium concentration will be more, urine hyperosmolar. So these are the symptoms. These are the symptoms. Treat the cause. Treat the cause. Fluid restrict patient को बोलो पानी बिल्कुल मत पीना, पहले ही तुम्हारे खून में बहुत पानी है, पानी एक्सक्रीट नहीं हो रहा बॉडी से बाहर, यूरिन में पानी नहीं निकल रहा, पूरा ब्लड में इकट्ठा हो रहा है. Don't drink water. So you have to advise your patient till we treat you, and treat the cause. Surgery करो, जो भी ट्यूमर है उसकी सर्जरी करो, ADH कम हो जाएगा, ब्लड में आप ठीक हो जाएगा. Give me a thumbs up if you got it. So second, so we have done with Cushing syndrome, we are done with SIADH. Coming on the third, hypoglycemia. Hypoglycemia. So hypoglycemia कौन से ट्यूमर्स में होता है? Tumor of pancreas. Pancreas में there are islet cells. You know islet cells. Two things are there in the pancreas: acini, which secretes enzymes, and islet cells, which secretes hormone. Islet cells have 4 cells: alpha, beta, delta, and SS. You know, PP. So alpha, beta secrete insulin. So islet cell malignancy is present with it. Diagnosis: you do a plasma insulin or C-peptide. You know what is C-peptide. Treatment: anti-cancer drug. Treat the cause. In सबका treatment एक ही है, treat the cause, treat the cancer. Don't treat the condition. Hypoglycemia है तो temporarily आप ग्लूकोज दे दो, उसका ग्लूकोज कम हो गया है ना. हाइपोग्लाइसीमिया, आप ग्लूकोज दे दो लेकिन वापस कम हो जाएगा वो. आप जितनी बार दोगे कम हो जाएगा, क्योंकि इंसुलिन बहुत है बॉडी में. इंसुलिन गैस कहां से आ रहा है? ट्यूमर में से. सर्जरी करो ट्यूमर की, ट्यूमर निकाल दो तो इंसुलिन ऑटोमेटिक कम होगा, हाइपोग्लाइसीमिया ऑटोमेटिक ट्रीट हो जाएगा. ट्रीट द कॉज. Treat the cause means do the surgery of the tumor, give anti-cancer drugs. Give me a thumbs up. Nephro C-peptide. C-peptide. So watch my lecture on diabetes if you want the detail. Gross मैं बता देती हूँ C-peptide यहाँ क्या होता है. From the beta cell of the pancreas, of islet of Langerhans cells of the pancreas, insulin is secreted. So insulin is secreted always along with C-peptide. So one molecule of insulin is always, this is one molecule of insulin, just suppose it is secreted along with C-peptide. So both of them are connected together. So whenever they come in blood, they come as a conjugation. One molecule of insulin along with one molecule of C-peptide. Insulin, endogenous insulin never come alone in the blood. It always come in blood along with C-peptide. So you can say insulin का जितना concentration है, उतना ही concentration C-peptide का भी होता है human blood में normally inside you, inside me. So what does it signify? आप बोलो इसमें इतना स्ट्रेस देने की क्या बात है? What is the significance? Now the person's diabetes is the most relevant, most prevalent condition in India. ना आपके घर में भी, neighborhood में भी कोई ना कोई diabetic patient होगा who is on insulin therapy. So external insulin हम दे रहे हैं injection से, subcutaneous injection. So external insulin का composition is same as that of natural insulin. So this is a molecule in blood which is natural insulin, green color, and this purple color molecule in the blood, this is artificial insulin. I want to test what is the natural insulin inside this patient. So I will take the patient blood sample out. So if I test insulin, तो वो तो total insulin test होगा ना. Structure is exactly same. There is no way to differentiate the two. Insulin as natural as well as artificial. So how you will know what is the concentration of natural insulin? Endogenous, not artificial. So you don't test insulin. You test C-peptide. आप blood में C-peptide test कर लो ना. C-peptide सिर्फ natural के साथ आता है, artificial के साथ नहीं. So if you test C-peptide, so you can say it is a surrogacy marker for endogenous insulin. This line is written in your books. So C-peptide is a surrogacy marker of endogenous insulin, not exogenous. Done. So that is the significance of C-peptide. Anyways, coming on the next paraneoplastic syndrome. Hypercalcemia. We are done with Cushing. We are done with SIADH. We are done with hypoglycemia. In all of them, first learn what it is. Second, learn in what tumors it is presenting. The third, what are the symptoms? The fourth, what is the treatment? So make a table of it, I guess. Table is given in initial portion of my lecture. So learn that table. Just modify that table. Coming on the next heading, hypercalcemia. Hypercalcemia. So it is due to secretion of parathormone related substance and also due to calcitriol, secretion of vitamin D. Some tumors secrete vitamin D in the blood. So ya to parathormone, ya to vitamin D. Done. You know the name of the tumors. You can read it of your own. Which tumors are secreting it. Done. Clinical features. अगर blood में calcium बढ़ गया तो क्या होगा? बढ़ने दो ना. Blood में 9 to 11 होता है. 11 से ज्यादा हो गया तो क्या होगा? Normal calcium levels are 9 to 11 milligram. 11 से ज्यादा होगा तो क्या होगा? There are many symptoms: cardiovascular symptoms, GIT, renal, rheumatological, musculoskeletal, psychiatric, neurological. तो क्या क्या होगा? Cardiovascular में patient presents with hypertension and short QT and arrhythmias. Renal में patient presents with polyuria, polydipsia. ज़्यादा प्यास लगेगी, ज़्यादा यूरिन आएगी. GIT में patient presents with constipation and vomiting. Rheumatological में patient presents with gout and pseudo gout. Musculoskeletal में patient presents with bone pain and weakness. Psychiatry में anxiety and depression. And neurological में hypotonia and hyporeflexia. So a cluster of symptoms is indicating patient is having hypercalcemia. You do a blood calcium level, it is raised. It can be a malignancy. It can be a malignancy. So what is the treatment? Treat the cause, otherwise give symptomatic treatment till you treat the cause. So we are done with hypercalcemia also. Last is carcinoid syndrome. What is carcinoid syndrome? Carcinoid syndrome. So carcinoid syndrome causes, some tumors secrete serotonin in them. So which tumor? Gastric and bronchial, stomach or lung ka cancer. They are secreting serotonin. So patient is presenting with these symptoms. So patient will have flushing due to serotonin. You know serotonin is an autocoid. In autocoid, histamine, serotonin is 5-HT. So it is an autocoid. It will cause flushing, vasodilatation of the facial blood vessels. So patient will present with flushing. एकदम लाल face होगा जैसे flush कर रहा है. So flushing, number 1. Difficulty in breathing. Number 3, irregular, increased heart rate, swelling in the ankles, diarrhea. The peristalsis is increased. So patient is presenting with diarrhea. Due to diarrhea, abdominal discomfort and cramping in there. In the stomach, cramping, spasmodic pain is there. So these are the symptoms of carcinoid syndrome. Diagnosis: do HIA or do MRI. Yes or no? And treatment: by treat the cause, remove the tumor as soon as possible. Done. So these are there neurological lamps is there, but you can skip it. You know what is lamps. You can read it of your own. Treatment. And there are some dermatological conditions also which present as paraneoplastic syndrome, especially acanthosis nigricans. So patient is presenting with a black necklace patch. You can see the necklace over here. Necklace, black colored necklace. Acanthosis is typical. If you are a dermatologist looking at the patient, you say you have acanthosis nigricans. But it can be simple acanthosis nigricans or it is secondary to a malignancy. Name the malignancy. The malignancy is gastrointestinal tumor, GIT tumor, prostate tumor in males, breast tumor and ovary tumor in females. So these malignancy can result in acanthosis nigricans. Done. Give me a thumbs up. So it is a darker skin at the neck and at the armpits also, at the armpits axilla also. So that is, and last is Trousseau sign. You know what is Trousseau sign? It is migratory thrombophlebitis. Phleba means vein. There are artery, vein और capillary. So phleba मतलब होता है vein. Vein का Greek letter है phleba. Phlebitis means veins का inflammation. So can you see a vein here? This is a vein. It is inflamed. ये लाल हो गई है. Sometimes due to catheter or due to intracath also veins swell ना. You may have intracath experience. कभी ना कभी किसी IV injection के लिए आपने लगाया होगा यहाँ पे. So intracath और यहाँ पे. So it swells up. So that is thrombophlebitis. But it is migratory. Sometimes it is here, sometimes here, sometimes here. So veins of the body are swelled. Migratory thrombophlebitis. It is typically seen in gliomas of the brain. It is seen in pancreatic tumor and pulmonary lung cancer. So it is due to hypercoagulability, due to thrombus formation inside. Done. So yeah, I'm done with all. I would like to launch polls now. Are you people interested for the polls based on paraneoplastic syndrome? The important paraneoplastic syndrome are done by me. So I have told you the classification. Just learn the classification. From that table only most of the questions can be answered. So learn the table, learn the name of the paraneoplastic syndrome, learn the cancer in which it is related, and learn the reason why it is there. So 3 columns are there. And last is treatment. Treatment to sabka wahi hai, treat the cause. Done. So this is how paraneoplastic syndromes should be approached. And jo important, I had given the details of them. Should I launch polls? Are you people interested for the polls or not? It will take more 10 minutes if I launch polls. There are many polls based on it. So more 10 minutes. Can you afford it? Can you afford it? Yes or no? Give me a thumbs up. Or you will do it by yourself later on from the notes. Say something. So you want me? Thumbs up means you want me to launch. Yes, write something. Na thumbs up se mujhe kya samjhega? Okay, okay, you want to launch. Okay. So before launching, there's an announcement for you. So have I told you about ask about benefit of the? Yes, no, I have already told you about this. So these are the subscriptions available on the Unacademy app. There is plus subscription and iconic subscription. You know the difference between the two, no? In plus subscription, you will get only live lectures of Unacademy on the platform. In iconic subscription, along with live Unacademy lectures, you will also get recorded prep ladder lectures. So the charges are in front of you for 12 months, for 1.5 months, 2 years, 3 years, 4 years. So charges are in front of you. The best plan, most reasonable and affordable plan for a first year or second year student is 4-year plan. So installment is very, very affordable. It is around 1400 for iconic and it is 1200, around 1200 in the plus subscription. So you can go for the installments also. Plus subscription ke benefits you already know. I'm not enumerating it, but there is the question bank which is updated right now, a few days back only. And some questions are given by me also, new questions. These all 25,000 questions are new questions, new clinical based questions are there. So I advise you to take the subscription at least for 1 month, for 1 year, whatever is your affordability, your speed of study. So you take the subscription and take advantage of these new questions. In your exam, some of the questions will be from this question bank, that I can guarantee. So take the subscription and iconic subscription, I have already told you, along with Unacademy, you will get prep ladder also. New batches, there are 4 new batches which are starting from 11th of August. Today is 6th of August. Now 11th of August se 4 nayi batch start ho rahi hai, so you can enroll in that. So focus FMG batch if you are a FMG aspirant, NEET PG test and analysis if you are targeting NEET PG, next 2022 batch. So if you are targeting next, and ultra fast revision batch. If you are taking the subscription, you will be eligible to attend lecture in any of these batch, along with my free lectures also. And in some of these batches, I will take lectures also in the plus this thing. So these are the batches and these are the educators. So I will launch course now. Done. So that was a small announcement for you people. Done. So okay. So this you will get only 15 seconds, right? 15 seconds for one question. So this is the first question in front of you. Based on clinical features of tumors. Please be fast. Be fast as well as accurate. Don't rush. Yes. Cancer cachexia is due to which cytokine? So the options are TNF alpha, interleukin 5, interleukin 8, and phospholipids A2. Most of you are correct. The correct answer here is, of course, A and point. Nandini and Draksha are first to answer. Done. Correct answer here is A, TNF alpha. So I have already told you cancer cachexia is due to 3 cytokines, TNF alpha. Apart from TNF alpha, what other tools are there? अगली बार TNF alpha की जगह कुछ और ऑप्शन भी हो सकता है ना. So TNF alpha, interferon gamma, and interleukin 1, 5 for 8 9. These are the 3. Yes, IL-1, IL-1, not 6 necro. IL-1, interferon gamma, and TNF alpha. These are the 3 main cytokines, inflammatory cytokines, which are responsible for cachexia. So correct answer here is A. This is the next question in front of you. Be fast. Hypercalcemia seen in which cancer? Hypercalcemia, I'm talking about paraneoplastic wala hypercalcemia because I'm asking the cancer. किस cancer में secondary feature होता है hypercalcemia? RCC, renal cell carcinoma, or carcinoma of the stomach, or small cell carcinoma of the lung, or hepatocellular carcinoma. Most of you are wrong. You have marked lung. माना lung में most common paraneoplastic syndrome होते हैं, लेकिन ऐसा नहीं है ना सारे paraneoplastic syndrome lung में ही होते हैं. The correct answer here is RCC. Let me see. Let me check. The correct answer here is renal cell carcinoma. Na? Yes, renal cell carcinoma. So hypercalcemia, it occurs in lung also, kidney also. Lung also, kidney also. Yes, okay. Lung में, see the bracket. Zoom it out. Can you zoom the image? See lung के कौन से carcinoma में? It is squamous cell carcinoma, not small cell carcinoma of the lung. Okay, lung का अगर यहाँ पे small की जगह squamous होता, तो C is the correct answer. But see, examiner ने कैसा twist किया है तुम लोगों को? So examiner has twisted you. उसने जानबूझ के lung का option दिया, ताकि तुम लोग प्रोवोक हो वो टिक करने के लिए. बट लंग में उसने स्मॉल की जगह स्क्वामस की जगह स्मॉल लगा दिया. डन. और द सेकंड मोस्ट कॉमन इज किडनी. देन आफ्टर दैट कैन यू सी द किडनी हियर? आरसीसी. सो आरसीसी इज द सेकंड मोस्ट कॉमन है, लेकिन यहाँ पे मोस्ट कॉमन हो गया अमंग दीज ऑप्शंस. गिव मी अ थम्स अप इफ यू लाइक द क्वेश्चन. So that's how examiner can twist you. Done. So don't get confused. So you have to learn typically लंग है तो स्मॉल सेल कहाँ पे है, स्क्वामस सेल कहाँ पे. Done. So in the bracket, it is written in my notes. So you have to learn that also. So be accurate, specific. Specificity is the rule. If you want to crack any exam, you have to be specific. So general नहीं चलेगा. हाँ लंग है तो कौन सा? 4 होते हैं ना लंग में, तो लंग में से कौन सा वाला? स्मॉल सेल, लार्ज सेल, स्क्वेमस की एडिनो, कौन सा वाला कौन सा पैरानियोप्लास्टिक सिंड्रोम दिखा रहा है? अलग अलग पैरानियोप्लास्टिक सिंड्रोम में अलग अलग लंग कैंसर है. So you have to learn it. So correct answer here is A. This is the next question in front of you. Be fast. Except is there in the question. Don't rush. In tumor lysis syndrome, all of the following are seen except. What is not seen in tumor lysis syndrome? What is not seen in tumor lysis syndrome? Yes, hypernatremia, की hypercalcemia, की hyperkalemia, की hyperphosphatemia. चारों ऑप्शन हाइपर हैं. So hypernatremia, hypercalcemia, hyperkalemia, की hyperphosphatemia, which do not occur. So हमने पढ़ा है कि कैल्शियम तो हाइपो होता है ना. Only one hypo is calcium. So hyper कैसे हो सकता है? So correct answer here is B, because except is asked in the question. Now you will say, मैम आपने hyperkalemia तो बताया था, hyperphosphatemia भी बताया था, लेकिन तीसरा hyperuric acid था, hypernatremia तो नहीं होता है. लेकिन पोटेशियम बढ़ रहा है तो सोडियम भी पड़ेगा. Both of them are 1+1+, and so instead of sodium, potassium, I am considering sodium as same. Done. So correct answer here is B. Done, not A. So Nandini, Point and Necro are first to answer this correctly. Correct answer here is B. This is the next question, so you know it. This is the nenext question in front of you. Read it, then I will launch it. Otherwise, you will not get sufficient time. First, read it. Now I'm launching it. A 65-year-old male is present. A biopsy is done. He is having lung cancer with paraneoplastic syndrome and increased calcium. So what is the probable cause of increased calcium in a patient with lung cancer? So patient is having lung cancer and he is having increased calcium. Why is he is having increased calcium? Of course, due to parathormone related peptide, he is having hypercalcemia. And you tell me which type of lung cancer it may be. कौन सा वाला lung cancer होगा? Tell me the type of lung cancer. Now that is my question to you. Write in the chat box. Yeah, correct answer here is B. Point, Necro and Nandini, again they are first to answer it correctly. Yes, just now I have told you, no? So Pooja, Necro, Nandini, it is squamous cell carcinoma. So next time this question can come in your exam. So new questions are nothing. They are framed from old only. थोड़ा twist करके, थोड़ा उसके आसपास से उठा के नए question बन जाते हैं. Only point is आप पुराने question करते समय आसपास की पूरी थ्योरी cover करो. Have you got it? Have you got it? The correct answer here is B. Coming to the next question. Okay, this is the next question. Difficult. Okay, which of the following tumor is associated with polycythemia? Opposite of anemia, hemoglobin is raised more than 17 gram. Polycythemia. So polycythemia में कौन सा tumor होता है? So all of you are wrong. Only one is correct. Point is correct. So correct answer here is C. Cerebellar hemangioblastoma. See this table. Polycythemia. There are two tumors: kidney का RCC and cerebellar hemangioma. So you have to learn this table. No escape. I know it is not good. रटिफिकेशन बहुत है, लेकिन क्या करें, एमसीक्यू आएंगे तो लर्न करना ही पड़ेगा ना. If something is coming in your curriculum and you are unable to learn it ना, so motivate yourself कि your competitor is doing it. तुम करो ना करो, तुम्हारा जो competitor है वो एक सीट खाएगा और वो तो ये कर रहा है. तो अगर इस पे क्वेश्चन आता है तुम्हारी नीट नेक्स्ट जो भी एग्जाम है उसमें, तो उसका सही होगा, तुम्हारा नहीं होगा. So you are, अगर एक भी क्वेश्चन गलत होता है ना, you are 1000 रैंक बिहाइंड. एक क्वेश्चन कहने के लिए एक क्वेश्चन है वो 1000 से रैंक हो सकती है. Have you got it? So ranks 1000 से खसकेगी. एक क्वेश्चन सही किया तो 1000 रैंक आगे हो सकती है, एटलीस्ट 500 तो आगे हो सकती है. एक क्वेश्चन गलत किया तो उतना ही पीछे भी हो सकती है. So each and every question matters. So each and every topic matters. Done. So you can't afford to miss even a single topic if you are expecting your rank in top 100 or top 1000. You can't afford to miss even a single topic from the all 19 subjects. You have to cover your all 19 subjects cover to cover from first page of the book till last page. And my advice to follow standard textbook during your MBBS years only. यूजुअली होता क्या है, एमबीबीएस ईयर्स में तो मस्ती. यूनिवर्सिटी एग्जाम के टाइम छोटा बुक पढ़ लोगे, स्मॉल वाला बुक पढ़ के जैसे तैसे सीनियर के नोट्स पढ़ के यूनिवर्सिटी एग्जाम निकाल लोगे. इंटर्नशिप में यू टेक रॉबिन्स, यू टेक लव एंड वैली, यू टेक हैरिसन. अरे अब थोड़ी कोई होगा, एक ईयर में तुम क्या 19 स्टैंडर्ड बुक्स पढ़ लोगे? नो, यू कांट. नो वन कैन डू इट. So you have to study from your first year only. Take standard textbook, start reading it. Now the digital, तुम्हारे टाइम पे तो हर चीज डिजिटल है ना. At our time you are very lucky, you have everything handy in the mobile, in your tabs, you have available. So whatever you don't know, just at one click, the information is available. At our time, we have to go to the library, search for the books, and we have to see what information we can gather. So you are lucky people. Everything is handy. Only thing, devote your time. Devote your time, devote your dedication. Material बहुत है, free में भी available है, पैसों पे भी available है. Everything is available at a single click in your hand. Only thing, तुम्हारा motivation, तुम्हारा devotion कितना है तुम्हारी studies के लिए. So that is the thing. So I'm not giving a motivational talk. I'm not in a mood anyways. So that is for you. Yes, take it. So समझदार के लिए इशारा काफी है. बाकी तो जितना भी बोलो कम है. Done. So the MCQs on Paraneoplastic Syndrome is done. Now rest of the MCQs, I am having 100 more MCQs, but these MCQs from now onwards, these MCQs are from general neoplasia and from carcinogenesis and from the genetic regulators, that is proto-oncogene, tumor suppressor gene, DNA repair genes, and apoptosis regulating gene. So these MCQs are from that portion. So I'm not taking it now. I will take a separate lecture for these MCQs. So you can attend it, or it is available in my notes also. You can download the notes later on. So let me announce my next lecture. I'm halting here only. So let me announce my next lecture. I've already told you about the new batches which are starting from 11th of August. You can enroll in them. Thanks for being with me. I really enjoyed you teaching you, and please give your feedback. I've told you about the subscriptions. Yeah, this is the timetable for grand test series schedule on Unacademy. On every Sunday it is there. And this is a scholarship. Please participate in the scholarship test. It is numerical based scholarship test. So it is a test based on numbers. It is on 14th of August. All NEET PG aspirants, you can give this test. It is 1 hour test. 50 numericals will be there from your syllabus only, from PSM, from pharma, from various subjects. These numericals can be, but only numericals are there. And if you come in the top 3 or top 5, you will get free plus subscription. So please participate. करने में क्या जाता है? At least analyze कर लो ना. So mark the date. It is 14th of August, 8 PM in the evening. 14 अगस्त को शाम को 8 बजे न्यूमेरिकल का टेस्ट है, स्कॉलरशिप टेस्ट. इफ यू विन यू विल गेट फ्री प्लस सब्सक्रिप्शन. डन और नॉट? And 4-year subscription plan पे there is discounts are going on, and there is one more offer for you. If you are taking 1-year subscription 12 months, you will get additional 2 months. So by paying 12 months you will get 14 months subscription. If you are taking any subscription plus Iconic 1 month, 4 year, whatever, apply this code. Learn the code. It is Sachdev, my name, Dr. Priyanka Sachdev, SACHDEV. It is not Sachdeva. Sachdev 10. Many students confused. So Sachdev 10 is the code. You will get maximum discount if you apply this code just before payment. And this code is also useful. Distribute this code to your batchmate, to seniors, juniors, for unlocking my free classes. So free classes के लिए भी ये कोड यूजफुल है, और सब्सक्रिप्शन लेने के लिए डिस्काउंट में भी यही कोड यूजफुल है. So don't hesitate to distribute this code on your batch groups, seniors, juniors, interns of your college, other college, all over the globe, any medical. So distribute this code. They can watch my free classes at free of cost. And don't forget to follow my profile link, Telegram channel. Please join this Unacademy Telegram channel for getting the notification. You can join my Telegram channel also. That is MedLive by Dr. Priyanka. Search under Telegram, MedLive by Dr. Priyanka. Write it completely, Priyanka. So just join the channel. You will get the notifications. Install the app. And I'm taking classes on YouTube also. The name of the YouTube channel is Let's Crack NEET PG. So subscribe it, like it, share it. Some classes will be on the YouTube. Next class, tomorrow morning, 9 AM one class, 10 AM another class. Both the classes are on YouTube. Tomorrow, both the classes are on YouTube. Tomorrow, I am going to cover a topic, diagnosis of cancer. आज clinical feature हो गया ना, कल होगा diagnosis of cancer. So in diagnosis of cancer, my special emphasis will be on tumor markers. So I will take special emphasis on tumor markers, and a compiled MCQ of the entire neoplasia will be presented there. So tomorrow morning, 9 AM, I will see you there. So join me. So see you. Bye-bye.